It's been nearly 2 months since North Carolina's new abortion law took effect.
Tonight, Spectrum News 1 reporter Patrick Thomas takes us inside a North Carolina clinic to look at the impact through the eyes of those who work there. So, Patrick, what have you learned?
Brittany and Mike, from my conversations with multiple clinics, there is greater competition for time slots than before the law changed, including at a woman's choice in Raleigh. The clinic manager here says wait times for appointments are longer, but people in favor of the new law say it is in the best interest of the mother and unborn child.
So patients they'll first come into this room for an ultrasound.
Amber Gavin oversees operations and advocacy for A Woman's Choice, a group of abortion clinics both in and outside of North Carolina.
When folks come into the clinic, we don't want them to feel like it's super medical in here, but we want them to feel like it's a welcoming, inviting environment.
Creating a safe space is important to her.
Their personal items, cell phone, all of that into a locker.
Gavin is a sexual assault survivor. She tells me she tried to talk about her options with her then doctor, asking about emergency contraception. But the doctor told her they couldn't help because even recommending Plan B was against their beliefs.
And I remember feeling such shame and anger that a healthcare professional who I trusted wouldn't help me access the medical care that I wanted and then what I knew was best for me.
It's why she entered this field. Now the work she does on a daily basis is evolving. Aside from changing the time women have to seek out an abortion, the Care for Women, Children, and Families Act requires a face-to-face counseling appointment at least 72 hours before receiving an abortion. A modification to the prior law when in-person counseling was a choice and a patient could opt for a pre-procedure consent phone call. The law also requires more paperwork, a consent form that asks multiple questions, which supporters say makes a potential patient well informed.
These are all common sense requirements to ensure a woman understands her pregnancy and her options.
I have to read them a script that the state has made up.
Nurse Jennifer Hilly has worked at the Raleigh-based A Woman's Choice clinic for 7 years and walks every patient through the consent form. But she worries the questions have other motives.
But there are statements in here that I think almost shame the patient.
In her eyes, repeatedly mentioning and rewording any reference to abortion makes patients feel even more vulnerable.
Am I really sure of what I want to do? We have to ask them that multiple times, trying to put doubt into their mind and shame them and make them feel guilty that they're doing something wrong.
And they have to initial beside every line.
And I just don't think that's very compassionate.
However, North Carolina General Assembly Senate President Pro Tem Phil Berger says it's about being a voice for the voiceless.
What we were trying to do is move the needle in the direction of protecting unborn life, and we feel that this bill does that.
They want to ban abortion in North Carolina. They're trying to shut down the clinic so that people can't get in-person care, and that's cruel.
For Gavin, it's her patients who are top of mind.
And I think that's one of the things that's so important to me. As a patient and her mother were leaving, they grab our arms and we'll just say, thank you so much for providing care, or thank you so much for what you do. And that's what matters. That's what keeps us motivated.
Consulting is a much bigger part of operations for clinics, including A Woman's Choice, now than in years past. Gavin tells me they constantly review protocols for legal compliance. Before changing the law, the average wait time was 10 days and up to 2 weeks. Now she says the same eligible pool could be on standby for even more weeks. While clinics deal with this new normal, at least one founder of a pregnancy crisis center tells me they are receiving more phone calls asking about the alternatives to abortion, which for the pro-life camp is a major win. Brittany, back to you.
Okay, Patrick, thanks. And here's another look at those changes specifically in North Carolina's new abortion law. It outlaws most abortions after 12 weeks now, or 3 months. It has exceptions through 20 weeks for cases of rape and incest, as well as exceptions through 24 weeks for life-limiting fetal anomalies.